Central Illinois is the CI in CI Living.
It seems like all the time you're hearing about a critical need for blood donors, but here's the thing. We are in a very unique time right now around the world, the country, and here in Central Illinois. Blood drives are being canceled left and right, and that immediately reduces the number of units for the medical field. Here with more insight on how coronavirus is affecting Central Illinois Community Blood Center, we have Jim Watts joining us now via Skype. Hi, Jim. Thanks for joining us.
Hi, thank you so much for having me.
So we all know that the coronavirus is affecting our small businesses pretty hard, but it's also affecting our blood centers. How so?
Absolutely. So obviously we have to continue to maintain 24-hour operations. And like you mentioned, we are seeing blood drive cancellations. We have some folks who are hesitant to come out, but we really need people to come out, make appointments, keep those appointments, and we're really encouraging blood drive hosts to be able to continue to open up their doors and allow us to come in for these mobile blood drive operations.
Let's talk numbers here, because I'm reading that you have a projected loss of 130,000 units nationwide. That's a lot of blood.
That is a lot of blood. So across the nation, as you said, that dip of 30 to 40%, that's going to take a big impact. So we have to work very hard locally to make sure that people know that it's a safe process to come in and donate blood and be able to help out our patients here in our own backyard.
And it's something that is also surprising to me to learn is that blood only has a 42-day shelf life. That seems short.
It is short, so that's why we always have to make sure that we have donors coming in, and so we can replenish that stock. So 42 days for those red blood cells, but platelets and thawed plasma only has a shelf life of 5 days. So wow. We need to make sure that we always have people coming in. So do we need donors right now? Absolutely, but we will continue to need donors throughout however long this pandemic lasts. So in 2 weeks, 4 weeks, 6 weeks, we're going to need those donors.
And I'm sure you are taking everybody's health and safety into concern when it comes to blood donors with some special safety precautions and screening procedures.
Absolutely. So but first and foremost, we want people to know that blood donor sites and locations are not social gatherings, right? So we're only asking for healthy individuals to come in, and we will continue to do and stick to our stringent FDA guidelines and what we have to do, and stepping that up just a little bit more to make sure that all of our donors and staff are taken care of and are healthy for this process.
And that's taking care of the donors themselves. But what do you say about those people who are concerned about the risk of getting maybe somebody's blood who has coronavirus in it or something along those lines?
Sure. So the coronavirus is just that, a virus. So there is no known indication that it can be transmitted through blood transfusions, blood collections, donating blood. It's a viral infection, so it's not something that's going to be passed through blood.
So you should absolutely feel safe and comfortable donating blood at this time.
Yes, absolutely, and every day. We take every precaution that we can to make sure that our donors feel safe, and right now we're just taking a couple extra because in the end, the patients at our local hospitals need those blood products. And so we're just asking the community to continue to come out because we do have a strong community that comes out and donates blood, and we just need them to come out again.
And I'm sure, speaking of community here, we've just lost a big chunk of it with our University of Illinois students all being sent home. And I know that was a big part of your donors, with whether they were having their own blood drives as students or just coming in on their own.
Absolutely. You know, we would see thousands of units at the university. Any given day, especially in the spring, you come on the quad, you're probably going to see our bus there. You're not going to see that now. So we have to rely on other folks in the community to come in. Maybe you're someone who donates once or twice a year. We're asking you to come in now. Bring a friend. If you've never donated before, this is a perfect time to come out and help the people here in our community.
Yeah, and definitely make a difference from those people who are in need of blood around the clock, like you mentioned there, whether it's a cancer patient or somebody having a baby or some kind of tragic, traumatic event. So we appreciate your time hanging out with us. If somebody wants more information and they want to help make a difference and donate blood, what's the best way for them to go about that?
The best way is to go to our website, bloodcenter.org, and you can sign up for an appointment to give blood. And we have our donor centers in Urbana, Danville, Mattoon, and our Springfield Donor Center as well. We're looking to expand those hours to accommodate as many people as possible.
All right. Thank you, Jim, so much. And hopefully we can put the call out there for everyone who is willing and able to help make a difference in the lives of others who may need that blood to survive. And we'll have a look at their website when you go to CILiving.tv. Jim, thank you so much.
Thanks for having me.